Ask your TMCP doctor.
To our pilot episode of Ask Your TMCP Doctor with our guest, Dr. Frances Bernadette Q. Karamat, an OB gynecologist. Our topic for this episode is understanding cervical cancer. Out of 10 women that we asked, the most frequently questions are the following. The first question, Doc, is what is cervical cancer and how does it develop?
So cervical cancer is the second most common cancers among Filipino women aged 15 to 44 years old. And in Filipino, ito po yung cancer ng kwelyo ng matres. And 95% of your cervical cancer is caused by your human papilloma virus, which is usually transmitted through sexual contact.
Doc, since you mentioned HPV, can you explain the role of human papilloma virus in the development of cervical cancer?
Your human papilloma virus is the culprit of your cervical cancer. So it begins with an initial infection with your human papilloma virus, which may occur during your adolescence and may regress. However, persistent exposure to your human papilloma virus, your high-risk strains, may lead to cervical cancer. Okay, so it basically begins with a break, an entry to your basal membrane, where your E6 and E7 oncogenes play a major role in the uncontrolled viral replication of your human papilloma virus, leading to your cervical cancer.
Third and last question, Doc. What are the common signs and symptoms of cervical cancer and how do they vary across different stages?
The common symptoms of your human papilloma virus include your bleeding in between menses, okay, pain during sexual intercourse or bleeding after sexual intercourse, an increase in your vaginal discharge, or postmenopausal bleeding. But in advanced cases of your human papilloma virus infections, you can notice leg pain, back pain, pelvic pain, or swelling of one or both of your legs, and in most cases, foul-smelling vaginal discharge or profuse bleeding.
Doctora, what are your recommendations to us women to prevent the risk in having cervical cancer?
Okay, so your cervical cancer, it's highly important to note that it's a very preventable disease. We can prevent this by getting your HPV vaccinations and practicing a lifetime monogamy and abstinence. Okay, and along with my fellow OB-GYNs, we highly recommend regular screening of cervical cancer through your pap smear every 3 years and your HPV DNA every 5 years. But to know more, you have to consult with your trusted OB-gynecologist here at the Medical City Pangasinan, where patients are partners, and we gladly would invite all your questions.
Thank you very much, Dr. Frances Bernadette Q. Karamat, for joining us today for this important conversation about cervical cancer. We've covered a lot, from understanding the risk factors and symptoms to the life-saving importance of early detection through regular screenings like pap smears and HPV tests. These small steps can make a life-changing difference. Remember, knowledge is power. Share what you've learned today with someone you love. It could save a life. Until next time, stay informed, stay empowered, and take care of your health. I am your host, Giselle Sanchez. Thank you for listening.